Thanks for joining us for another Contagion Coronavirus video. Today, we are joined by Dr. Jeannette Bouchard, who is with the University of South Carolina and Prisma Health. Thanks so much for joining us.
Of course, yeah, not a problem at all. Happy to be here.
Great, we're happy to have you. So Dr. Bouchard is an infectious diseases pharmacy fellow. So we're going to be talking to her a little bit about what she's been seeing on the front lines of response to this pandemic. So my first question is, can you speak to what your roles and responsibilities have been in regards to COVID-19?
Of course. So like many probably have found themselves right now, my roles and responsibilities have certainly been interesting and very fluid throughout this process. Being a fellow here at the university as well as Prisma Health, I started out this process at one of our smaller community hospitals doing stewardship. So when we first started to see patients in our area, I was doing stewardship, but then also kind of swinging to help with clinical work and ICU clinical work, because at our smaller institution, the stewardship pharmacist typically does the ICU and stewardship at the same time. And so I was balancing that plus having 2 students, and then our COVID cases kind of started to hit. And so our students got bumped off campus, so started to do distance work, and then we started rolling out different investigational agents and just trying to get a handle on how we're going to manage these patients and the PPE issue. So I found myself running to codes and being more of a PPE steward and being a liaison between the infection prevention physicians as well as our ID physicians at this smaller hospital. So it was definitely quite the role to take initially, all while in the background helping our larger ID group and our larger infection prevention group kind of sort through literature and look through all of the theorized therapies that we're using, as well as how these patients present, what we can do for these patients, what's the best supportive care for them. So I found myself doing a lot of background, larger hospital communication work, as well as working more on the front lines from a clinical side right up front, which was definitely a good experience to say the least.
So are you currently being exposed to using any of the investigational agents for COVID-19?
Definitely am. So we're at I'm fortunate to be at one of the larger academic hospitals in the area. So we were able to become a part of one of the remdesivir trials through Gilead, as well as we're currently working through getting convalescent plasma for some of our patients, as well as working through a couple of other different study avenues as well, and trying to maybe do some studies of our own at our own campus, not just going in on one of the larger studies. So we have a smaller investigational drug services department, and so we only have 1 pharmacist, and I've been kind of helping her a lot with getting some of these studies up and running and gathering the data on them and the communications. And so I've become kind of her second-hand woman in that process, and me and her are tag teaming a lot of the different protocols and initiations and communications with the investigational drugs. So I'm getting a little bit of a dab in what being an investigational drug pharmacist is on a super fast and furious scale, because these trials it's not conventional for what they normally do. When speaking with anyone who's in IDS or investigational drug services, they'll certainly tell you that clinical trials don't roll out this fast. So they're on quite the escalated scale of rolling out within a month, when normally it takes 6 to 8 months to even get site visits and get things like that up and running. So it's been quite a lot of fun, a lot of learning, and a lot of questions have to be asked in order to make sure everything's running smoothly and safely for our patients.
So can you provide us with some information on how your institution is managing patients with COVID-19?
Right now, we're primarily focused on making sure that everyone is educated about all of the information that's coming out. So we're providing a lot of education to physicians about the theorized medication options for COVID. There's a lot of talk about hydroxychloroquine and chloroquine, remdesivir. So we're trying to keep education on the forefront and make sure that people are making informed decisions when having treatments. We don't have set in stone guidelines for our physicians, and it's up to their discretion how they want to be treating these patients, but we want to make sure that they're as educated as possible. So that's kind of what we come with and how we're managing our patients. Supportive care is definitely first. A lot of the management up front that we were doing with these patients was how we're gonna manage a whole floor of these patients going forward. So we started cohorting them, as well as figuring out ways to kind of steward, as I was saying before, with the PPE, so the personal protective equipment, because it's difficult to have a lot of these COVID patients mixed in with other patients. So working on supportive care, making sure that the patients are kind of cohorted to certain areas of the hospital or certain hospitals within the area, and just making sure that everyone's using educated approaches to treatment with these patients in terms of the theorized options out there.
So as someone who's on the front lines of this situation, what has been the hardest part for you so far?
So that's a great question, and one I often think about. I think when I go home is the hardest part of my day. A lot of family members, I think, typically also ask this question. Initially, the hardest part was just the sheer amount of data that was coming out and still is coming out, and having to dig through that on a daily basis. Like pandemic aside, you're already digging through a lot of literature and a lot of the new stuff that's coming out. Email and online journals make it really easy for people to publish data. So now adding COVID on top of this and the amount of information people want right away, it's hard to kind of dig through all of that data and really impossible for one person to do. I think Matt was saying before that it's like drinking from a fire hose, and you kind of hear that effect anytime you're thrown into something that's a lot to handle. That's definitely what this situation has become. So trying to gather colleagues, trusted colleagues, to critique this data and kind of relying on their opinion, but on also looking through when you can some of these papers is super important. And often the hardest part of this time period right now is we don't know what we're doing, and we're having to sift through a lot of data that's somewhat helpful or not helpful at all, and trying to figure out which ones are really not helpful is one of the hardest parts. And then from like a personal side, I think it's definitely the most difficult part is watching the number of families, like full families, that come into the hospital. So it's kind of a different, we see a lot of patients who are really sick on a daily basis, but it's not too often that you see a whole family come in who's sick. And so that's probably one of like the hardest personal problems that I have throughout the day, is like watching these whole families come in and having to talk to them over the phone and give them information and help them sort through the information in the media and then compare it to their loved ones. It's a very difficult thing to be doing right now. So especially when there's not a whole lot of information you can provide people.
So can you speak to the critical role of the pharmacist in this evolving pandemic situation?
There's a number of different roles that I think are really critical for a pharmacist right now in this situation. One is true to our original kind of design as a pharmacist, and that's drug acquisition. So right in the beginning, when you had all of these different ideas about which drugs would work the best for COVID, there was a lot of drug shortages happening, and there still are drug shortages on these drugs that we're trying to use to treat COVID. So drug acquisition and making sure you have the right medications to be treating these patients, not just from an antiviral side, but also supportive care side. So you'll see a lot of critical care pharmacists asking for sedation and intubation medications that are going on shortage, just because of the sheer number of patients who are needing them right now all at the same time. So it's not just the theorized antivirals, but also the supportive care side, which is the side that's most important right now. So pharmacists can definitely help there, and helping their hospitals kind of manage that aspect of it. It's a very important part, and coming up with alternative pathways. So when you run out of one drug, what drug goes next, and what are the different things to be worried about? So that's a big part right now of our pharmacist job. But they can also help in the investigational agents area. So like I was saying before, we have our IDS pharmacist, or investigational pharmacist, helping out a lot. So her job kind of ramped up pretty quickly, especially with our trials kind of rolling out. So they can help there, as well as helping with dosing of these agents. So looking into a lot of the data there about which dosing is going to work best, what to watch out for in certain patients, making sure you're evaluating the literature and keeping up on these different therapeutic options, and we're not causing more harm than good in certain areas. So there's a lot of different ways a pharmacist can help right now. And I think the most important thing is to just throw yourself in there and kind of help where you can and do what you can to help right now. I've kind of got my hands in a lot of different pots for that reason. So wherever someone needs me, I kind of am there because I'm a post-grad trainee, so I don't have a full-on position at this hospital. So I have that extra time to kind of do what I can in certain areas. So a pharmacist can be a part of nearly every aspect of this situation. You just got to find your niche and go in there and get it.
Absolutely. And it sounds like you're definitely doing that. So my last question for you is, do you have any resources or tips to share with other clinicians who are starting to, see an increase in the number of patients with COVID-19?
Certainly, there's tons of different resources online. I use SIDP, which is the Society of Infectious Diseases Pharmacists, a lot. They put out great podcasts, great literature reviews. Contagion has also been like a good source for their people's experiences, as well as reviews of some of the antiviral or anti-COVID treatments that people are looking into. IDSA, I know, just put out guidelines for management of COVID patients. So the IDSA is a really good place to look, as well as your CDC, WHO. They put out guidance that can help with certain areas of managing COVID patients. But also, I think talking with your colleagues and making sure you're setting up discussions for literature review and talking with other team members will definitely help you manage these patients better, because I'm hyper focused on all of the infectious disease related information for COVID, because that's where I like to learn and that's what I do. But I have a colleague who's a critical care pharmacist, and she's hyper focused on all of the things that an ICU pharmacist would need and making different sedation pathways. So I have a lot of discussions with her about how she's kind of managing a patient from an ICU standpoint, and like what we can do from an infectious diseases standpoint to help her. And then also having conversations with nurses as well as respiratory therapists, and just working together as a team to kind of piece together what everyone needs. Everyone's kind of a little bit in the dark right now. So if you can work together as a team and take a multidisciplinary approach, that's probably one of the best ways to start kind of managing these patients better. As soon as you start to see them come in, is just try to get the whole team on board in terms of what you best want to do and what strategies you should take.
Well, this has been great. Dr. Bouchard, thanks so much for taking time out of your schedule to join us. We really appreciate all your insight, and we wish you the best of luck in handling this situation.
Thank you so much. I appreciate it.